If I may, to Ms. Davis. You mentioned that you offered high deductible coverage for your employees. For many here in Congress, these plans were supposed to be the answers to all the problems in the small group market. While these plans may be lower priced, can you talk to us about some of the shortcomings of these plans in controlling healthcare costs?
The major shortcoming with the high deductible policy, Congresswoman Velázquez, the major shortcoming with the high deductible policy is that for the employee who, say, for example, has a pre-existing condition and they have not yet saved that deductible, that becomes an issue for them in terms of they may have to scale back on their care because they cannot afford to pay all the funds upfront to pay for themselves. That's a major issue that employees face because not everyone can find $3,000 upfront, right away if they become sick early in the year. Maybe after 10 or 12 months of saving, that money is there, but that's a major issue that they have.
Ms. Fox, this committee held a series of hearings last Congress focusing on consolidation of the healthcare industry. What we have learned is consolidation has left small businesses with fewer insurance carriers to choose from and higher prices. According to your testimony, state-based connectors or exchanges are better for small businesses than national ones. Given that consolidation threatens to eliminate competition in the state insurance markets, why would a state-based connector be better?
Thank you. Well, first of all, we don't think that consolidation has really reduced the number of insurers in the marketplace in a significant way. GAO looked at this back in 2005, and what they estimated was that on average there are 28 insurers in a state, in most states, which is a lot of competition. I think when we look
Down
at,
from how many?
I'm not sure, but I think still
Well, that's
28,
the real question.
I think, I don't know that. I'd be happy to look for that. But I think 28 insurers in a state is a significant number of competitors. I'd say that when you look at the states where there have been a lot of competitors leaving the market, the reason has not been consolidation. It's been the regulation has been very, very tight. You look at places like Maine, Massachusetts, New Jersey. That's where you've seen a lot of insurers leave the marketplace, and our perception, I think it's best to ask them, is that they've left because the rules have been very tight.
Well, perception is not fact.
No, yes. Yeah, I'll just say that's our perception.
If I could interject, in another life I was an antitrust lawyer, and the one thing I would say is you never measure competition by counting competitors. You have to measure it by share. And I think, you've looked at that issue, and there are definitely some issues in terms of shares that would suggest from an antitrust perspective that there might be market power in at least some markets.
Well, I would add on to that the federal government has looked at this, and they've where there has been consolidation, and when insurers get to a certain size, they use it to get leverage with hospitals and doctors, and it directly benefits the consumer. So this is something that has been examined very closely. And I'll just be candid on our market share. We have about a third across the country. In market share. And state connectors, we think state connectors would be better because it would be piggybacked on the existing state infrastructure. There are state regulators who have excellent long-term expertise in protecting consumers, and we don't think that it makes sense to reinvent that at the federal level when we have state experts there. So what we designed is a program to get the benefits of what we've heard of from a national exchange, which is simplify shopping for small employers. I think when you go and you try to shop as a small employer, I used to be a small employer, and it's very difficult to shop for insurance. So we designed this to really simplify the process, make it easier, and I think it would also reduce the administrative costs for small employers, for administrative costs for us as well as small employers.
But don't you agree that a national exchange will provide more transparency, and that consumers care more about what is out there for them to see and to choose from?
We agree 100% that we need transparency, but we think you can get all that transparency at the state level and having state connectors and require every insurer to be listed on that site. So it's not just some, but everybody, so you know everybody in the market. I think it will really increase competition.
So why do you think that, the real issue here in terms of cost, bringing down cost, that the rising healthcare cost is a systemic one? So how could you explain that the premium cost has not come down, even after you talk about putting together a strategy that will have the effect or the goal of bringing costs down?
I agree. Bringing costs under control, is a huge problem facing this country, and we all need to work together. We have strategies in place, but we can't do it alone. We need to partner with the federal government, and we have very specific recommendations on how, working with the federal government, that we need to be looking at changing the incentives, for example, for providers. Right now, the way we and the government pay is that the more you do, the more money you make. We need to change those incentives. And I'll give you just one example of a program that we have underway where we think it's really making a difference. Our plan in Pennsylvania is now paying hospitals to reduce their infection rates. And what they've shown is that through giving them coaches to help them in the hospital and giving financial incentives, they were able to bring the infection rates where people were getting sick unnecessarily way down. We think these are the kinds of initiatives that need to be pursued.
Anybody else would like to comment? Let me ask you, Ms. Fox, why do you think that the Massachusetts experience has not been able to bring costs down?
Well, I forgot who mentioned, I think it was Mr. Ratner was talking about that. I think that they've focused on expanding access first, and controlling costs is something that they're now working on, and we think you need to do both together. We think everybody needs to be covered, but you need to attack the rising costs at the same time, and I think they did the expansion first. I think that's, we would do them together.